Do you get hip pain going upstairs? If you'd like to be able to climb stairs without your hips hurting, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you a simple 3-step system to be able to climb stairs comfortably without your hips hurting. Now, before we get into the 3 steps, it does help to understand what causes hip pain when you're climbing stairs in the first place, because each step of the system is going to address a different component of hip pain. And if you don't understand what's causing the pain in the first place, the steps aren't going to make any sense. So first of all, what causes hip pain when you're climbing stairs? Well, I like to think of hip pain, or any pain for that matter, in terms of an iceberg. And the part you actually see above the water is the symptoms, so the hip pain in this case. Now, most people know that 90% of an iceberg is below the water. So the things that are actually causing the hip pain are, in the case of outer hip pain when you're climbing stairs, either hip bursitis or gluteal tendinopathy, or a problem with your IT band. Another common place where people get symptoms is in the front of their hip, and that can be caused by hip arthritis or a labral tear. It's usually a problem inside the joint when you have pain on the front of your hip. Now, most treatments such as medications or injections or massage therapy, they just address the local symptoms, finding the area that's causing it, possibly the structure that's causing it, and treating that. We actually want to go a couple layers deeper. So deeper than that is, why did the hip pain start hurting in the first place? Because even if you treat the symptoms and the structure that's causing the pain, if you don't address the thing that caused that to hurt in the first place, eventually the pain's going to come back. And in many cases, that's improper or faulty movement patterns when you're climbing stairs. Well, the improper movement patterns when you're climbing stairs usually fall into one of 2 things. And regardless of which of those types of hip pain you have, it's usually either your knee going inwards like this, stretching the muscles across your hip and impinging in the hip joint, or your pelvis dropping down like that, which again stretches the muscles over the outside of the hip and pinches in the hip joint. So it doesn't really matter which problem you have. If you're having those 2 movement patterns, then it can cause hip pain. Now, what causes those is weakness in your hip muscles or gluteal muscles, particularly the muscles that balance your pelvis and keep your knee from going inwards, and the muscles that help you to climb up a stair. Additionally, and something that people don't often think about, is the muscles in your foot that help maintain your arch and give you a stable base or foundation are really important. Because if you don't have a firm foundation, then your structure or building is going to be unstable. And so we want to address both the movement patterns and the dysfunctions that cause those faulty movement patterns in the first place. Now, you may argue a chicken or the egg, which came first, the weakness in the hip and the foot, or the movement patterns? Did faulty movement patterns cause the hip and the foot to become weak? And the answer is, you could argue either way, but it really doesn't matter, because if you perform the correct movement patterns consistently, your muscles get stronger and you learn the right movements. Conversely though, if you just strengthen the muscles, you don't necessarily relearn those faulty movement patterns. So this system, this 3-step system, is going to address the correct movement patterns and functional strengthening exercises. So you may wonder at this point, what are the 3 steps? Well, step 1 is going to be learning the correct movement patterns on 2 legs. Climbing stairs is a 1-leg activity, but if you can't do it on 2 legs, then it's going to be really hard to put your full body weight on 1 leg at a time while you're climbing stairs. So to do that, step 1 is going to be doing strengthening, standing in front of a chair, and doing a modified squatting pattern. Now, we want to start from the foundation up at the feet and start by doming your arch. So kind of grip the ground with your toes, make sure your arch lifts up off the ground, and pretend someone put a thumbtack underneath your foot. You don't want to step down on it. So keep your arches lifted, and you'll notice that kind of turns your knees out a little bit. You want to turn your knees out because that strengthens your hip external rotators, or your glute muscles. So you're curling, gripping the ground with your feet, squeezing your glute muscles. Now you're going to go into a little modified squat. And it's easier to go down than it is to come up. So start by going down slowly. And I would have a chair behind you for safety. Go down slowly, as deeply as you can comfortably, while still keeping your hips and knees in the correct alignment. And then come back up fast. So go down slow and push through your heels and come back up fast. When you come up fast, that creates more power, which you need to get up the stairs. Power is defined by the amount of energy you're able to produce per unit of time. So the units are kilograms, meters squared over seconds to the third. And so the time factor, the speed factor, is really important in how much power you can generate. So go down slowly and then push up fast. Go down slowly, as deeply as you can, and push up fast. And keep this in a range where you're comfortable going. Don't go down any deeper than you feel comfortable. And if you lose your alignment and your knees start coming in, that's as deep as you're going to want to go to. So keep the correct alignment. If you're able to get down and touch the chair, then come up fast. Go down slow, come up fast. Go down slow, come up fast. And when you're able to do that 10 times, getting just about all the way down to the chair and then coming up fast, you're probably ready to move on to the next step. So the next step is going to be starting to move into one leg strengthening. The ability to keep your body balanced over one leg while still keeping your arch lifted and your knee turned out. It is often helpful to hold on to something at first for balance and for safety, as well as just to give you a little more stability, because this can be kind of difficult. So hold on to something initially, dome your arch and turn the knee out, and then stand and maintain your balance. Now, another component of climbing stairs is you have to be able to lift your non-stance leg to step up to the next step. And if you have to hike your pelvis up like this to get to the next step, then when you place your foot on the step, show it from a different angle. When you place your foot on the step, you're already going to be in a faulty movement pattern. If you're hiking up like this, and then you're placing it there. So when you're climbing the stair, you want to be able to lift your knee without hiking your pelvis up. And to do that, you may need to focus on turning your knee out just a little bit. So you want to keep your waist or belt line level while lifting your leg, still maintaining the arch in your foot and your knee turned out. And there are rails on stairs, so you don't necessarily have to be able to do this without holding on, because again, that's kind of hard, but you shouldn't really need to grip down hard for balance. So use as little help from your hands as you can. Do 5 to 10 repetitions on one leg, and then switch legs. And do 5 to 10 repetitions on the other leg. Now, when you can stand in balance with just minimal help from your hands and do 10 repetitions of lifts on each leg, then you're ready to move on to step 3. And that's where you actually start to go up the stairs. So for step number 3, we're going to actually start to move onto a stair. And you can do this on a regular stair, but it does help to have an aerobic step that's adjustable height, because the lower the stair is, the easier it becomes to do. So you'll want to start down on a lower stair and then progress up to a higher step as your muscles get stronger. Now, it is a good idea to hold on initially. You're going to start out doing a sideways step up. So if you're on the stairs, put your foot on the bottom step. If you're using an aerobic step like this, just stand sideways to it. Hold on to the chair. Realistically, it's probably going to be over here, but I'm going to put it in front of me just for viewing purposes so you can see the hip and the foot. And put your foot on the stair. And again, dome your arch. Make sure you've got a good hip, knee, toe alignment. Then push through your heel to come up. Now, this is actually going to be the starting position of the exercise. So you're going to come down slowly, just like the squat. Come down as low as you can, touch your heel to the floor, and then come back up quickly. Go down slowly, keeping a good alignment, and then come back up quickly. Go down slowly, and then come back up quickly. And again, start from a low stair and then progress up to a higher stair as you're able. Now, when you're able to build your step up to the height of a normal step and do 10 repetitions, you're probably at the point where you're going to be able to climb stairs more normally. And to do that, when you're climbing stairs, you'll put your foot up on the stair, dome your arch, keep your knee turned out, and then drive up through your heel, not just stepping up onto the stair, but actually stepping through the stair as if you're going to go on to the next step. So hopefully you found this helpful to be able to go upstairs more comfortably without your hips hurting. Now, a word of warning, this doesn't happen overnight. You may have to practice this for days, weeks, or even months, depending on your starting point. But in the meantime, you may still have to be able to go upstairs. And so there are some tips that you can use in the meantime while you're getting stronger to be able to go up and down stairs more comfortably. And I'll show you those in this other video over here. But before you go, if you found this video helpful, make sure to give it a like, and if you haven't already, subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.